All right, section 15.3, disorders and injuries of muscles and tendons. Muscle disorders of skeletal muscles. I see muscle disease and disorders are typically characterized by pain and muscle weakness. Fibromyalgia affects the muscles and tendons all over the body, causing chronic pain associated with fatigue and depression. Its etiology is unknown. There are no laboratory tests for it and no specific treatment except pain management, physiotherapy, and stress reduction. Polymyalgia rheumatica is an inflammatory disease of muscles that causes pain and stiffness on both sides of the body, particularly the neck, upper arms, buttocks, and thighs, with general feeling of not being well. Most people who develop this disorder are older than 65. Let's see. Myasthenia gravis is a chronic autoimmune disease characterized by varying degrees of weakness in the skeletal muscles. The weakness increases with activity and decreases with rest. Okay. Facial muscles are often involved, causing problems with eye and eyelid movements, chewing, and talking. Antibodies produced by the body's own immune system block the passage of neurotransmitters from motor nerves to muscles. Muscle dystrophy is a general term for a group of hereditary progressive disorders affecting skeletal muscles. Duchenne muscular dystrophy, DMD, is the most common, occurring in boys who begin to have difficulty walking around the age of 3. Generalized muscle weakness and atrophy progress, and few live beyond 20 years. There's no effective treatment. Injuries of skeletal muscles. See, muscle injury is very common and usually results from athletics or vocation. Muscle soreness may be a result of vigorous exercise, particularly if your muscles aren't used to it. Exercise causes buildup of lactic acid in muscle fibers, and the resulting inflammation of them and their surrounding connective tissue produces soreness. Muscle cramps are sudden painful contractions of muscle or group of muscles. They're usually a short duration. The etiology of cramps is unknown, but low potassium, calcium, and magnesium levels, use of caffeine and tobacco, and diminished blood supply are possible causes. Okay. There are no effective medications available. Hi, Smiley. The cramp is usually self-limiting. Let's see. Okay, muscle strains range from a simple stretch in the muscle or tendon to a partial or complete tear in the muscle or muscle tendon combination. A sprain is a stretching or tearing of a ligament. Okay. Rhabdomyolysis. Rhabdomyolysis is the breakdown of muscle fibers. This releases a protein pigment called myoglobin into the bloodstream. Myoglobin breaks down into toxic compounds that cause kidney failure. Rhabdomyolysis can be caused by muscle trauma, severe exertion, marathon running, alcoholism, and use of cocaine, heroin, amphetamines, or PCP, phencyclidine. Tenosynovitis is inflammation of the sheath that surrounds the tendon. It is usually related to repetitive use, occurs commonly in the wrist and hands in computer users. and is beginning to be seen in the thumbs or frequent textures. It produces pain, tenderness in the tendon, and difficulty in movement of a joint. Treatment is rest, immobilization, nonsteroidal anti-inflammatory drugs, NSAIDs, local corticosteroid injections, and occasionally surgery. Achilles tendinitis results from a small stretch injury that causes the tendon to become swollen and painful. A larger partial or complete tear leads to loss of function with difficulty in walking and no ability to push off. Common disorders of the shoulder girdle. Rotator cuff tears. A frequent injury to the shoulder girdle are caused by wear and tear from overuse in work situations or in certain sports such as baseball, football, and golf. These tears can be partial or complete. Tendinitis of the shoulder joint is caused when the rotator cuff and or the bicep tendons become inflamed from overuse. Bursitis, inflammation of the lubricating sac of the rotator cuff, can be produced by overuse. So cyst, an abnormal fluid containing sac. Duchenne muscular dystrophy, named after Guillaume Benjamin Duchenne, born 1806, died 1875, who was a French neurologist. A condition with symmetrical weakness and wasting of pelvic, shoulder, and proximal limb muscles. Okay, fibromyalgia, pain in the muscle fibers. Ganglion, Greek for swelling, fluid containing swelling attached to the synovial sheath of a tendon. Neurotransmitter, chemical agent that relays messages from one nerve cell to the next. Rhabdomyolysis is destruction of muscle to produce myoglobin. Stenosis, steno means narrow, so narrowing of a passage. Strain, overstretch or tear in a muscle or tendon. Sprain, a stretching or tearing of ligaments. Tendon, fibrous band that connects muscle to bone. Tendinitis, inflammation of a tendon. Tenosynovitis, inflammation of a tendon and its surrounding synovial sheath. Common disorders in the elbow. Lateral epicondylitis is caused by overuse of the elbow joint or poor techniques in playing tennis or golf. Tendons of the upper arm and forearm muscles are inserted into the medial and lateral epicondyles of the humerus just above the elbow joint. Small tears in the tendons and their attachments occur with overuse, and eventually enough tears accumulate to cause pain and restrict elbow movement. The pain occurs when straightening the elbow or opening and closing the fingers. Ligament strains and bone fractures due to heavy fall or a blow to the elbow are also common injuries. Common disorders of the wrist and hand. Your wrist and hand are under constant use, therefore they're prone to disorders and injuries. Ganglion cysts are fluid-filled sacs arising when the synovial tendon sheaths that run over the back of the wrist are irritated or inflamed. They often disappear spontaneously. Stenosing tenosynovitis is a painful inflammation of the synovial sheaths on the back of the wrist. And carpal tunnel syndrome, CTS, develops on the front of the wrist and results from inflammation and swelling of the overused tendon sheaths. Repetitive movements like typing on a computer keyboard can lead to CTS. The feeling of pins and needles or pain or loss of muscle power in the thumb side of the hand are common. In the hand flexor tendon, injuries occur as a result of lacerations. Because of the flexor tendons lie just beneath the skin on the palmar surfaces of the fingers, they're very susceptible to injury even with a shallow laceration. Even after repair, there can be residual stiffness and limited motion of the fingers.